Hi, good afternoon, everyone, and thank you for joining us today. My name is Simon Sulima, in Ukrainian Saman Sulima. I'm the president of the Ukrainian National Federation Ottawa-Gatineau branch. UNF and its volunteers have been proudly serving our Canadian Ukrainian community for almost 9 years. And today we're going to talk about coronavirus pandemic and its impact on our community. I feel like everyone is super excited to hear our two wonderful speakers today, so I'm not gonna take up much of our time now, and we'll get straight to the business. But before I do that, I just wanna say that this event couldn't have been possible without the help of our tireless volunteers, and so I would like to especially thank our our UNF Ottawa-Gatineau members, Vicky Karpiak, Oля Masitsky, and Melania Buba for the idea and implementation and making this event a reality. So today we have two wonderful speakers, and so let me. I also see that there is people joined from not just from Ottawa, Gatineau, but from all over Canada, which is great. So this event is really like countrywide, and we also we also are recording this event, and we're gonna upload it to our YouTube channel in the next couple of days. I would like to ask everyone to mute themselves so that our speakers don't get distracted. And let me do the introduction of our two special guests today. So we have Dr. Sherrie Kelly and Dr. Melania Buba. Dr. Sherrie Kelly is an infectious disease modeler specializing in the global health economics. She helps country governments around the world to invest in their health budgets. Dr. Sherrie is located in Ottawa, and she leads the Australia-based Burnet Institute Optima Group for HIV, tuberculosis, and malaria modeling. And in the past, she worked at UN ADIS and the Public Health Agency of Canada. Our second speaker today is Dr. Melania Buba. She's a lead for patient flow at CHEO Hospital, CHEO's regional response. And during the COVID-19 pandemic, Dr. Buba has been instrumental in the development and implementation of virtual care on the inpatient units in CHEO, as well as serving as the lead for patient flow for CHEO's regional response. Melania is also a long-time active member of the Ukrainian Canadian community, and so she recently served as a co-president of the Ukrainian National Federation Ottawa-Gatineau branch. And today is Melania's birthday, so let me say happy birthday, Melania. And so on behalf of the community, I want to wish you all the best. And it's very nice that you decided to spend this evening with us today.
Thank you, Simon.
Yeah, thank you, Melania. So without further ado, I'm gonna switch over to our first speaker, Dr. Sherrie Kelly. Sherrie.
Thank you, Simon, and thank you to the group for inviting me. I hope you can hear me clearly. So, we're all together today and, facing a pandemic. And the title of today's talk is Staying Safe During the COVID-19 Pandemic. So I just wanted to give you an overview of a bit of information. Some of you may be very familiar. And then we're going to go over to Melania. She's going to address a lot of very key questions, and then we're going to have a question and answer period. So let me start. So what is COVID-19? So COVID-19 stands for Coronavirus 2019, and that's when it was first identified, which is an illness caused by the coronavirus known as SARS-CoV-2. The reason it's called corona is the picture on the bottom is there are spike proteins on the virus surface that looks a little bit like crowns, and corona in Latin means crown. And Melania tells me, I hope that's the word for crown in Ukrainian, so maybe that will be something that sticks in your mind. The virus was spread from an animal, probably a pangolin, which is like an anteater, to humans. And these viruses are common. They cause typically mild illnesses like the common cold, but in this case, you can have more serious symptoms like fever, cough, difficulty breathing. It can take up to 2 weeks after you get exposed to the virus to develop the symptoms, but you can also get infected and may never show symptoms. Over 40% of people in a small town in Italy that were tested were infected with the virus but showed no symptoms. So it can go undetected, but then you can spread it to others. So who's most at risk for getting infected? The risk to Canadians is considered high, and those most at risk are people over the age of 65, someone with a compromised immune system, so already have some immune problems, and underlying medical conditions. There are also other circumstances that can make people more vulnerable, economic, physical, and social. But just to note, the government of Canada has invested an extra $100 million to improve access to food for Canadians facing these kind of difficult circumstances during the pandemic. So what are the status of cases in Ontario? We focused at Ontario because, as my understanding, that this chapter of the group is based around the Ottawa area, but of course, if you went to the Government of Canada website, you can see the number of cases for your particular province or territory, etc. But in Ontario, for instance, there are almost 16,000 cases and almost 1,000 deaths. And Melania is going to talk to you more about, the situation in the hospital. But of these cases, 977 have been hospitalized, and 186 are in ICU and ventilators. So they're the most serious cases. But the good news is, of course, of these, cases, there have been almost 10,000 that have been resolved. So how do you prevent the spread of the COVID-19? So you guys have probably all heard this, and maybe you hear this every day, but the best way is to wash your hands, often with soap and water, for at least 20 seconds each time. Avoid touching your eyes, nose, mouth, especially with unwashed hands. People are very tactile, so you tend to touch your face and touch your eyes and nose, and that's how you might spread the virus and get it inside your system and become infected. Avoiding close contact with people who are sick, of course. Coughing and sneezing into your sleeve, not your hands. And we've all heard about social or physical distancing, which is the recommendations to stay at least 2 meters apart. So if you're sick, stay home to avoid spreading illness to others, and wear a non-medical mask or face covering if you're going to go out in public. That last one is a little bit contentious, but it's, there's a potential recommendation to wear a mask when out in public if you have to go. So what emergency measures are actually in place in Canada? So they've implemented the emergency order under the Quarantine Act. So as you know, anyone coming into Canada be quarantined. That's to say, even if you don't have any symptoms, but you've traveled, you have to stay at home and monitor your symptoms and avoid contact with people. So staying in quarantine for 2 weeks or 14 days. If you've traveled and you have symptoms, you must isolate. So that means you stay at home, but even staying in a separate room or use a separate bathroom from others in your home if possible. So people are asking, how long can this virus remain infectious? In the air, at least 3 hours, they tested, but on something like plastic, it can remain active even after 3 days. So then people were asking, okay, if I have to go out for groceries, which are essential, then what do I do with my groceries? And basically, the suggestion is to come home, put your groceries, let's say, on the counter, and then immediately wash your hands. Put all your groceries away and wipe down the surface where you put your groceries, and then wash your hands again. There's no need to disinfect every item as long as you wash your hands before and after you eat. The risk of you getting infected in those cases is very, very low. And this comes from Dr. Farber, who's a professor at the University of Guelph. So it's closed, at least in Ontario, and it does go province to province or territory. So non-essential businesses and services at the moment are closed. Schools, public gatherings of more than 5 people, rec centers, parks, and of course, international travel routes. But there are essential businesses that are open, and here's the list. And you can go to the Government of Ontario website to find out more or read this long list after the presentation. So we know about, other infectious diseases in the past. So we want to compare this coronavirus to those other diseases to see how deadly it is, which is up on the right-hand side, and how many people get sick on the bottom. So if we compared it to something like, if you think about the 1918 Spanish flu, it's up here in terms of how deadly it is versus how many people it infects. And then if you compared it to something like polio, which is down here, it's somewhere in the middle. The thing about being a very deadly virus like Ebola, people would get infected, they get very sick, so they stay at home and they die very quickly, unfortunately. But then they don't have to pass it on, so it can die out very quickly. Something like measles isn't all that deadly, relatively speaking, but it infects a lot of people, and that's why we see it continuing on in our population. There are even measles outbreaks in Canada. So if we want to compare it to other specifically coronavirus outbreaks, you might remember in 2002 to 2004 in Canada, of course, we were hit by the SARS outbreak. There's also something called MERS, which is the Middle East Respiratory Syndrome outbreak, and now there's COVID-19. So when we compare them, we compare something called R0, or the reproduction number, and we think at this moment that COVID-19 has an R0 of about 2 to 2.5. And if we compare that to SARS, has an R0 of about 3, a reproduction number of about 3. But then we think, okay, SARS and COVID-19 first were reported in China, but if we think about the SARS outbreak, it was about 8,000 infections, where at the moment we're almost at 3 million infections. So we definitely have more infections by far from the COVID pandemic, and as well as more deaths. The reason that the COVID-19 epidemic, however, even though it has a similar or even lower reproduction number, is that it originated in Wuhan, and Wuhan is a city in China that has it has a hub connected by rail and a major airport. So it spread very quickly around the world, and we're even more globalized. That means people traveling from one country to another in rapid succession than we were compared to the early 2000s. Also, there was inadequate risk assessment and response early on, unfortunately. And the key to responding in a pandemic is quick and early response. So this is actually what I do and with my group. This is another group that's located in Seattle that put forward these predictions, because people often ask, okay, we're in a pandemic. How bad is it going to get? And when is it going to end? So what we do is we use computer models and we try to predict how long the epidemic or pandemic will go on, how many deaths there will be, and how many hospital resources will be needed. So in this case, they predicted the deaths per day would peak basically yesterday. So they're assuming, though, that the physical distancing or the social distancing is going to be maintained. And if it were maintained, they think the daily deaths would come down, 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 and be practically zero by July 1st. However, there's a lot of unknowns when we look at modeling, and this light pink area is the uncertainty, and the uncertainty means the amount of unknownness around this actually dashed red line. So this is, of course, total deaths in Canada, and they think again that it's going to start plateauing by about July 1st, and the actual uncertainty is quite big, up to 12,500, and then with a low of something like 3,000. So we'll see where it lies. But again, when social distancing measures or rules or orders lift, this could also change. And just lastly, and this will tie into what Melania is going to talk about, these are the estimation of the resource needs. And so this group estimates that there is actually going to be an ICU beds shortage in Canada of about 800 beds. So that is definitely something that can affect the response, because if people don't have beds and ventilators, of course, when they get very sick, then it's going to be a dire situation. But they did think that the peak in resource needs was about, April 23rd. So maybe we're over the peak. I guess we'll see. Just a few last slides, just to say some lessons from the last pandemic is that leaders should be on the same page. Physical distancing shouldn't end too soon, and I'm going to show you an example of why, and that we can adapt to stay connected and to use our talents and ideas to help eradicate the pandemic. So this is what the 1918 Spanish flu looked like in 2 cities. In the dark black line, this was Philadelphia, and you can see these are deaths. So the deaths just shot straight up from about September and then came down from October to November. A huge peak in deaths. And this is compared to St. Louis, which is this gently curving dashed line. I mean, these are still a lot of deaths, but the difference between the outcome in these 2 cities is because St. Louis had strong social distancing measures, whereas in Philadelphia, they waited 8 days before they started banning gatherings, and in that time, they had a huge parade, and so a lot of people got infected, unfortunately, and died. And just the last thing in St. Louis, they started, their death rate was relatively low, so they lifted the ban on social gatherings. They lifted the measures for social distancing, and then unfortunately they saw a rise in the deaths. They replaced the social distancing rules, and then the deaths came back down. So that's just to say we don't want to necessarily lift these orders too soon. That's not to scare anyone. That's just to say that we need to be cautious. So what do we need to stop the COVID-19 pandemic? We need treatment. Of course, there is no treatment to date and we don't have a vaccine. So we would need a vaccine, and the estimate is a minimum of 18 months down the road to have a viable vaccine. And if we don't have that, they suggest that we would need treatment to be about 95% effective. Or we can basically have it so that we run out of people to infect, and that's being done by social distancing. If we don't get too close to each other, then we can't infect one another and pass it on and pass it on. We need to have testing, but testing in a strategic way. Once you are identified that you're infected, to trace back anyone that you have come in contact with. And then of course, at some point opening up, because we need to allow the economy and our well-being to benefit, but we have to decrease the risk of further infection. So what's hopeful about this situation? Well, I mean, a lot of very motivated people and have come together, and vaccines have never been developed this quickly, and human clinical trials to test the vaccine effectiveness and safety has never begun so soon. And a lot of people are focused on the response, so people are really coming together. Just one example, in China, of course, because this virus spread from an animal to a human, they've ended dog and cat meat consumption. And the world is looking at what we call wet markets. So that's to say the sale of live animals in an outdoor market, and seeing if that's something that should be better regulated or even stopped, so that we would, in the future, stop these kind of pandemics. So again, the key is rapid and concerted global response. So we have to come together to flatten and plank the curve. And we're all in this together. Thank you.
Thank you so much, Sherrie. Very, very interesting. I realize there might be some questions, but so let's keep those questions after the Melania's presentation. And also, something I forgot to mention at the beginning is to make sure that we ask all the questions and we use our time efficiently. If you can just please write down your question in the chat window at the right, and then I'll do my best to read all the questions. So thank you very much. And Melania, over to you.
Thank you, Simon, and Vitayamo. Hello, everyone. Thank you for joining us this evening, and thank you to Sherrie for such a Amazing presentation. I think what I love about your presentation is that you take a lot of very complicated things and make it very easy to understand. So thank you for that. And I think in our current climate of information overload, having the facts laid out in such a succinct and clear way from an expert in the field is really, really valuable. So thank you so much for joining us. So for my section, I actually am going to do it a bit more conversationally versus a presentation, and just walk you through a few questions that have been prepared for me to kind of take a lot of the information Sherrie has presented and describe what that actually looks like in reality. So what does, as a healthcare worker, currently working more than I've ever worked before, how does COVID change what I do day to day and our healthcare system? And there's, as with Sherrie's presentations, a lot of unknowns, but certainly we have done a lot of things. And I would say we have changed healthcare delivery in Canada in a very significant way, very, very quickly. So with that, I'll ask Simon to start with the first question.
Sure. Thank you, Melania. So the first question we have is, as COVID-19 is a primarily adult disease, how is CHEO affected by and contributing to the relief efforts?
That's a great question. And as many of you probably have heard and have seen, COVID is a child-sparing disease, meaning children are largely asymptomatic. Not to say they can't be carriers, but they are certainly not affected symptomatically in the same way that adults are. And I'm happy to say that, in my role, well, one of my roles, which I'll get into in a minute, but, I have very good situational awareness of what's happening in the community around hospitals and capacity. And I'm happy to say that as of today's phone call, we have no current capacity issues in our ICUs or in our adult hospitals to care for patients, which is great. However, as many of you have likely heard about at this point, the challenge has really, the chink in the armor has been our long-term care facilities. And certainly in the last week, we have seen an influx of patients come from long-term care facilities. And unfortunately, because of the difficulties and the outbreaks in the long-term care facilities, those who come into hospital likely can't be discharged. So we have a lot of older adults coming into the hospitals with really nowhere to go at this point. And so they are predicting, the region is predicting we may have some challenges with capacity in the near future. So we're keeping a close eye on that. But CHEO's real focus is to help our community partners the way that we can, but to really keep, as the only tertiary care pediatric center in a very large region, our leadership has decided that it's really important for us to keep our expertise at our hospital and not send our physicians into the adult world if we can avoid it. And so we've put together a bit of a response to the pandemic that offers our services, yet keeps our expertise in our hospital for pediatric patients that need it. In fact, just looking across the country, there are very few admitted patients, pediatric patients with COVID. I think last time I spoke to my colleagues across the country, I think there were maybe a total of 5 patients who were admitted with COVID, most in Quebec, but many of whom did not require intensive care, many of whom are actually quite well, and that really very few. At CHEO, we have had 0 admitted pediatric patients with COVID. Saying that, we have created a COVID unit, meaning all patients who are admitted and tested get sent to one unit. And the way we're protecting ourselves in the hospital, we're doing it in such a way to assume that there is COVID everywhere. So for example, big focus on hand hygiene and proper isolation, personal protective equipment, screening of staff and visitors every single day, limiting visitors to the hospital. And most recently, we've adopted universal masking, meaning anyone in the building is required to wear a surgical mask while they're in the building, even though we're all healthy and asymptomatic. So that's been sort of the recent change. In terms of CHEO's regional efforts, so as I said, we are committed to keeping our pediatric expertise in our hospital. However, we have developed and are working on a way to help the region in that we very well may accept adult patients into our hospital from other centers. And that's one of the roles that I'm currently involved in. I sit on the regional response committee as the person responsible for figuring out how to make this happen. So developing a standardized process of bringing adults into our hospital, developing relationships with adult physicians in the community in the event that we do have adult patients in our hospital, essentially, for, advice or even, repatriating them back to the adult hospitals around discharge planning. But if I can be honest, I think pediatricians are actually in a great position to be caring for adults with COVID because it is a respiratory illness. And that's basically what I do all the time. Most children who are admitted with the flu or viruses in any other year, I should say, they all come in with breathing challenges. And so 90% of what I do is around breathing. And so I really feel like pediatricians are in a unique position to really be able to help some of the adults that may need us in the future. CHEO has also redeployed a lot of staff into long-term care facilities, both from a nursing, personal support worker, healthcare aides, and our IPAC, our infection control group, is actually going into some of the long-term care facilities to do risk assessments, environmental assessments, et cetera. And the last thing I'll say about how we're helping the community is that we've had a very active group involved with children and teenagers who are homeless or living in shelters, which are another vulnerable population for this disease, and looking at places to relocate them, how to support them through this illness, because let's face it, if you're homeless, you don't really have anywhere to go and physical distancing may not be possible. So I'm very proud of the work that group has done in reaching out to some of those folks, and we will continue to respond in whatever way we can.
Wonderful, thank you, Melania. My next question, you sort of already started answering. I was going to ask you, how are you personally involved in this, and if you can elaborate a little bit more on what you do.
Yes, absolutely. So as I mentioned, I do sit around the regional response table, but in addition to that, I am the boots on the ground. So I spend a week at a time working in the COVID unit, seeing children who are admitted, managing them, testing them for COVID. I just finished one of those weeks last week, and it is very busy and it's a very stressful time for families because honestly, with the number of things that we're testing or number of symptoms that may be COVID, which grows every day, we're testing a lot of patients. And there's nothing more stressful for a family that when they think their child may have this disease. So that's kind of my day-to-day. I also spend some time working at the COVID assessment centers. So the one set up at Brewer Arena. And that's actually very interesting work because you work very closely with nursing and a lot of adult physicians who take care of adults, and it's very collaborative and a pretty neat operation. If anyone's had to go there, it's very efficient, very organized, very impressive. And then the other big project I'm involved with is delivery of virtual care. And I don't know if any of you have had doctor's appointments by phone or by video conference. And that is something I am personally involved in developing, not from a clinic visit standpoint, but how to take care of patients who are admitted to the hospital virtually, because we really don't want to be up in the COVID areas or suspected COVID areas more than we need to be, or coming in contact with patients who are being tested if we can avoid it. So there's been a lot of work at CHEO over the last 3 weeks around delivery of care virtually using iPads, using Zoom meetings with families, with nursing, with other healthcare providers. That's been very exciting, but a lot of work. But I think it's coming along very well, and I'm very proud of the work that we've done. And it is quite an amazing new frontier for healthcare, to see how healthcare is changing so quickly, and very encouraging, actually. And I will echo Sherrie's comments around teamwork and collaboration. I have never seen teamwork like this before, not just within my hospital, but across the city, across the region, across the country. I meet with my colleagues nationally every week to discuss cases and strategies, and it's been quite an amazing experience.
Okay, wonderful. Yeah, I can tell how excited you are, just by how you telling us about sharing your experience. So yeah, this is great. So Melania, a couple of days ago, I saw in the news that one of the hotels in Canada has been converted to basically to be able to take on patients. So can you tell us about resources which are in place for regionally to care for adult patients?
Mm-hmm. Yes, absolutely. So Simon, I think what you're seeing with hotels being converted into, mini hospitals or safe havens for, patients, or even, people who are looking for somewhere to go to physically or socially distance if they've been infected or tested. I think we're going to see more and more of that. The long-term care facility, issue is a real challenge. And I think that the region is responding very proactively. Like I said, every single day I am in a phone call with every hospital in the region, from Deep River, Chalk River, like all the way to Cornwall. The long-term care facilities are now calling into that to that daily phone call. Even twice a day we talk sometimes. And I think there is a huge desire for everybody to help each other. And certainly at CHEO, we are unique in that we have a lot of space. If you take out daycare and school, there is no way for kids to get sick anymore. So, this time of year, I'd be taking care of 15 to 20 patients at a time. Last week, I had maybe 5 to 10 patients. So our hospital has a lot of room to be able to help when needed. So there's a huge push, I think a huge desire for everyone to help across the region in whatever way they can. As I mentioned, there's also the COVID assessment center, which is really for relatively healthy patients who require screening because they've traveled or because they've come in contact. There's, a lot of healthcare workers who have to come in because their child has a cough or a snotty nose at home and they need to be tested. So if you fit into that criteria, then please visit the COVID assessment center. You can also check on Ottawa Public Health. They have the criteria for testing. They update it all the time. But there's also something called the COVID care clinics, which have just been set up, one in the West End on Moody Drive, I believe, and one here in the East End on Heron. This one in the East End is staffed by Montfort, the other one by the Queensway Carleton. And that's actually for adult patients, not pediatric, but adult patients who do have symptoms that are not mild, but that, their symptoms are maybe getting a little bit worse. They can actually do blood work at those care clinics. They can do x-rays at those care clinics. But certainly anybody with severe symptoms should go to the emergency department. I will tell you that the emergency departments are at an all-time low in terms of patients. People are afraid to go to the emergency departments, but I encourage people to please go if you need it. We are finding that patients at CHEO and on the adult side who do come to emerge come in sicker than ever before because they've waited, because they've been afraid. And I would encourage you to please, there are very good hygiene and personal protective equipment and cleaning practices in emergency departments. So if you are at home or a loved one is getting sick, please do not be afraid of going to the emergency department. They are there for you. So I would certainly encourage that. Also, family doctors in the community are doing a great job of virtual visits, both telephone and video. And so if you are, waiting for an appointment with your family doctor or need one, chances are they may be able to connect with you in some way, shape, or form through a virtual means. And then, of course, as I mentioned, Ottawa Public Health, they have an excellent website. They have an excellent social media presence. There's a ton of information. There's so much misinformation out there. I would really encourage you to check out the Ottawa Public Health website for any sort of symptom or treatment or safety related concerns.
Okay, excellent. Thank you. As a working parent with two kids, I can appreciate that, hospitals have less patients now. So, yeah. Okay. Our next question is, how do we talk about COVID-19 with our children and youth?
Yeah, so this is a question we get a lot at CHEO, and understandably, children are struggling with understanding what's going on and accepting what's going on. And I'm talking from toddler to teenager. I think everyone is struggling with the change, but I think the most important thing to remember is that kids. You need to give kids the truth. You need to give them the facts, but it needs to be age appropriate and it needs to be simple. And so, breaking down the information into, manageable, age appropriate, developmentally appropriate info bits is really, really important, as well as being calm with your kids and being patient. They're going to ask a lot of questions, and I would say always answer truthfully, but they need to feel safe above all else. And I think as a parent or as a caregiver, if you're feeling stressed or anxious, understandably, about what's happening, that may not be the best time to talk to your children about COVID and about everything that's going on, because they will see all of your emotions. As anyone with children knows, you can't fool your kids. And so it's really important that, caregivers take care of their mental health before they have these very, challenging conversations with their kids. I think, for adults, we say limit exposure to the news, take breaks, only look at reputable sources. Even for myself, like I can barely keep up. I have my morning news time and my evening news time, and everything in between. I don't look. I would say for kids too, it's, kids are at home, they're on their iPads, they're on their phones, they're on social media. There's a lot happening in those environments that may or may not be helpful. And so I think, trying to limit the exposure that children and teenagers have to those, to social media and to the news, and give them a bit of a mental break as well is really, really helpful also. And then the last thing I'll say about children and youth and COVID is the routine aspect. And, I talk to parents, some who have this homeschooling thing down, like, it was their job to be a teacher, and others who are just really, really struggling. And certainly from my perspective, I always say do the best you can in terms of that. But I do think some semblance of a routine. So, every afternoon going outside, every morning, reading, or just some rough routine, bedtime consistent, wake up consistent, can be so helpful. Routines are the way that children feel safe. If there's no routine, they can be quite anxious, and they really struggle a lot more. So just even keeping bedtime and wake up time the same can make a world of a difference. And then, of course, with the teenagers, just repeating the importance of physical distancing, just reminding them of the importance of that. I think, not being able to see their friends, and the weather's getting nicer, and not being able to be outside with their friends can be really hard, but just sort of reiterating why we're doing this.
Okay, excellent. Thank you. So the next question is spousal, elderly, and child abuse are on the rise. What advice do you have on this?
Yeah, so this is a tough topic, and certainly I can speak from the perspective of child maltreatment more so than elder and spousal. However, I think the themes are the same, and the principles are the same, and the reasons are the same. And I do have a colleague at CHEO who this is her life's work, and she is a huge advocate for these children. And she's actually written a number of articles in national newspapers around, being vigilant about looking for this and how to approach it. And there's a great video on YouTube actually that she recently published that I can send around as well. But I think the first thing is that we need to acknowledge that home is not a safe place for everybody. That's children, teenagers, elderly people, husbands, wives, boyfriends, girlfriends. Like it's not always safe. and that, certainly child maltreatment is common. A recent study in Canada actually found that 1 in 3 adults in Canada grew up with violence in the home. So that's a lot. That's every third person. So I think recognizing that it happens, and when it does happen, it most often is by the perpetrator is often a person the child knows and trusts. So having to be in an environment with someone like that for a child can be a very scary thing. And I think the other thing to remember is that when this happens, especially from if it's a parent, parents, they do really love their kids and they want to do right by them, but sometimes they can't because of other things that they're struggling with. And it happens in all socioeconomic backgrounds, all cultures, all communities, and that it's all around you. And so the best way to help is to be the person that reaches out to a child that that you may see out on the street, and all you need to say is, empathetically, must be hard to be at home all the time. How are you doing? Everything going okay? Do you need anything? Because often the victims of child maltreatment will say that that's really all it took, that someone asked them a question about how they were doing. And so, if you are out for a walk or you're speaking to a child or youth, just inquire, how they're doing, at home, and likewise to parents, empathetically asking, saying something like, I know it must be hard to be at home with your kids all day. Anything I can do to help? And it's amazing how that, simple question to a person or a family that's struggling, it may open up the floodgates, and your question may be more helpful than you ever thought it could be. So I think that this is something we just need to be very careful to look for and to act on if we are concerned. And as I said, I'm speaking mostly from a child maltreatment standpoint, but this applies to, seniors and anybody really. So, and the Ottawa Police Service is behind this too. They have issued statements to the public to be extra vigilant about watching for abuse. And so it is all around us, unfortunately.
Yeah. Melania, the last question we have prepared for you is, what self-care measures can people take to ensure good mental and physical health?
Yes, so the million-dollar question, and I think Sherrie touched on this quite a bit. So I'll try to not get into detail about some of the things she talked about. But I think as far as mental health goes, mental health is a very personal thing. There is no one-size-fits-all solution to maintain good wellness during this pandemic. So I would encourage everyone to spend some time thinking about what it is what self-care means to you. And then to make that a priority in your day. I've talked about unplugging from social media, taking a break. I think that's really important. And then stressing that physical distancing doesn't mean you need to be alone. So reaching out to, family and friends by telephone, FaceTime, Skype, just staying connected to the people you have relationships with. I think also being kind to yourself, and if you are anxious or feeling overwhelmed, just knowing that that's a very normal reaction to a very abnormal circumstance, and just not being hard on yourself if you do have days where you're feeling particularly worried or struggling with understanding everything that's going on. That happens to me, and I'm living this on the front lines every day. So just, taking breaks and being kind to yourself, getting outside every day. I'm actually very encouraged in my own neighborhood at how well people are adhering to physical distancing outside. Like you see people, walking their 2 meters around somebody, and, you see the bicycles going their 2 meters around people who are walking. And so I think, especially as the weather gets nicer, it's amazing what even 15 minutes of fresh air can do for your mental health. And then we talked a little bit about routines. And I do think even for me, working from home some of the time, I still try to get up at the same time in the morning and go to bed at the same time. So that's really, really important. As far as physical health goes, I think Sherrie had touched a little bit on the non-medical masks that people can wear when they leave the house. That was, Teresa Tam, our Chief Public Health Officer of Canada, had talked about that. I think that that's a good thing to do. A couple things I'll say about that though, is that, surgical masks and N95 masks really are not necessary. Those need to be left for our frontline workers who are, truly at risk of being very close with patients with COVID. And the other, I think, just to be clear about the purpose of a mask, cloth mask or surgical mask, is it's protecting other people from you. So there is no evidence that it protects you from other people. It's really to keep your secretions away from inanimate objects, other people. So it's really protecting others. And so I just wanted to make that clear because I think there's a lot of misinformation around what the purpose of these masks are. The other thing about masks is they may not be appropriate for everybody. So they, as a pediatrician, they can be a suffocation risk for babies and toddlers. So, don't take your children to the grocery store with you if you can avoid it. And it may not be the wisest decision to put masks on them, for example, for that reason. And also, if you're someone who's having trouble breathing, please don't put a mask. It's not going to help. You need to go to the emergency department and have someone take care of you. So there's the masks, and then there's the hand washing, which Sherrie, of course, brought up. And I will say that is the number one most important thing we can do, both in healthcare and outside of healthcare. 20 seconds hand washing, minimally drying your hands afterwards. So important. Lots of studies have shown that is the number one way to protect yourselves. But like I said, both as healthcare providers and outside of healthcare. And then Sherrie talked a little bit about disinfecting the surfaces. Some of the recommendations were around, once daily going around your home and cleaning sort of the high touch surfaces, using hot dish soap and hot water to wash your dishes, this sort of thing. So those are just some tips about how people can protect themselves and stay healthy during this time. But as Sherrie said, the information evolves on a daily basis. So we may get new recommendations down the road about as we learn more about this virus.
Excellent. Thank you very much, Melania. I don't know about you, our guests, but I feel both optimistic by listening to Sherrie and looking at the data, and also I'm feeling very good that we have such wonderful people to take care of us if we ever get sick. So thank you very much. I know we have about 10 minutes, maybe 15 for questions, and I see there is some questions already in the chat window. So if you don't mind, I'll just go over each and every of them. Maybe I'll start from the last one, which Anatoly Shatkovsky sent. The question was about masks, and I thought it's a good segue, from what you just talked about. So Anatoly is asking, where could one purchase a mask in Ottawa during this time? Because everywhere it's out of stock. Maybe Melania,
Well, I did get some very nice masks from Vicky Karpiak, but I will say that there are a lot of people out there right now making the cloth masks. And certainly, I certainly know some people in the community, both from the Ukrainian community and the non-Ukrainian community, who are making the cloth masks. And there are tons of instructions online on how to do that. So you will not be able to find masks in stores, and ordering online is you're unlikely to be successful with that as well. So the best bet, Anatoly, would be to check out places like Etsy, or if you know someone in the community who can make a mask for you. That's generally where people have been making their own. So that's generally where most people have been getting their cloth masks.
Okay.
Could I add to that?
Sure.
It's Sherrie. Hi. I also saw a video that you can make a cloth mask just out of a t-shirt and 2 elastics. You can just search it on YouTube. So if you don't sew like me, or you don't have a sewing machine, you can literally just kind of fold a mask together and then put 2 elastics around your ears. There is I think a general in the United States that demonstrated, and it took about maybe a minute to do it. So it's only cloth, like you're saying, Melania. like you're saying, it's to protect others. But I mean, this would be in a pinch, maybe something that people could do.
Thank you, Sherrie. So the next question is from Marko Levitsky. Marko is asking, several provinces, including Quebec, are planning to phase in opening new businesses. Is this too early, or do you think it's okay? Maybe Sherrie, if you want to take it.
Right. So, I mean, we're modeling different scenarios. So, like you said, it needs to be a strategic plan as to how to roll out opening of different buildings. And so, you know, there are different suggestions, and it really depends on what people consider, you know, essential, and then the next sort of circle around that, the next most essential and the next most essential. I personally think it's important to open it in a way and then monitor, because we have to see if opening, you know, the sort of the floodgates a little bit, that it's allowing the river to flow in a safe way and not like flooding us and, you know, getting more infections to spike. So I think it'll be the public health care workers and the government together and the policymakers who have to decide strategically what can be opened and then keep monitoring. Of course, you know, if we keep businesses closed for, you know, in longer and longer periods, people are not going to be able to work, and, you know, the economy is suffering, and, you know, there's a lot of other detriments. And so it has to be a bit of a balance. And so we're modeling this in different countries. And we're seeing that it depends on what type of business. It depends how people interact in that business. If it's a sort of a place that makes food, of course, there are different things to consider in terms of sanitation and et cetera. So it's really something that has to be examined, and I can't necessarily answer that. No one can. We're going to have to do it in a way where it's not an experiment per se, but it's something that we do in a planned way, and then keep monitoring all along. And I'm not saying that it's going to happen, but if you, of course, listen to some of the key public health officials in the States, they are warning that it's possible that at some point restrictions will have to be put back to some degree down the road. So just be prepared for, you know, keeping up with the information. And it's not to say that once it's open, that's it. We have to wait and see, because no one really knows how it's going to go about sort of like coming to kind of back to normal. The good news is, of course, that in Canada, you know, we got hit later. And so countries in Europe, for instance, and in China, they're already doing some of these experiments. So we can learn from them.
Right. Melania, would you like to add anything to that?
No, I think Sherrie answered that beautifully.
Yeah. Okay. Thank you, Sherrie. I think Marko Levitsky he asked a second question, which is sort of like related to this one, and he's talking about food crisis, you know, which can happen soon, and he's asking how can we reopen safely. So I think Sherrie already sort of answered this question, but I don't know if you want to add to that.
I mean, it's up to our food inspectors, etc., to sort of keep us safe in those regards. Yeah, we're going to have to follow their rules. I mean, I used to work in Winnipeg at the virology lab, or the National Microbiology lab, and those were the people who monitored those kinds of things. You know, what does a business have to follow to be considered safe when it's providing food to the public? And these things need to be followed. I mean, there were certain plants, I'm not going to name the plants, but that were closed down because unfortunately there were outbreaks amongst their workers. So it's a little bit on a case-by-case basis in terms of what people are following. But I think the important thing is people have been testing these things for a lot of years, and they do have expertise. It's really to follow their recommendations.
Thank you. Another question is from Renata. So what is the most recent information regarding immunity if one has had COVID? When will testing be available to look into this?
So I can certainly start with that one. So right now, the way we are testing for coronavirus is through something called PCR testing, which is polymer. You have to get me on that one, Sherrie. Polymerase chain reactions. Thank you. And basically, it looks for the viral DNA or RNA in nasal secretions or throat swabs. And so we know that is not the same thing as an antibody test. The evidence around antibodies for coronavirus is still very new. The Lancet, which is a pretty reputable medical journal just published something on this a couple of weeks ago, and they're saying that you should have IgG antibodies, which are essentially antibodies are the things that the body produces once it's been exposed to, in this case, a virus, within about 2 weeks of the infection. So that's pretty standard for antibody production. If we look at past coronaviruses, the immunity lasts usually a year or more. However, certainly with this coronavirus, we don't have any real certainty around like the immunological correlates of antiviral protection, or or I think what people are wondering about what proportion of the population needs to be immunized or immune in order for things to be safe. So we don't have that information yet, at least not that I'm aware of. So it's really impossible to identify a point when this certain level of immunity has been reached to make it safe to, not do physical distancing measures anymore and consider this pandemic over. So certainly from, the on the ground, from the on the ground folks, we don't have much information about this yet. We don't have any information about immunity that allows us to base decisions on it at this point. But perhaps down the road, we may have some additional information, but we're not testing antibodies at this time. Sherrie, I don't know if you have anything to add to that.
Well, I mean, it's probably some of the studies that you read, but I don't want to say it because then it makes people a little bit worried because we're not sure. But I believe it was in one of the Asian countries, either South Korea and China, 110 people seem to get reinfected, but they're again not sure if that's exactly cut and dry a true answer. So we're definitely hoping that's not the case. And we're definitely hoping that immunity lasts, like you said, up to a year or at least to some extent, but it's too early to say.
And how far are we from the first effective vaccine from COVID-19? What's your assessment, I guess?
I mean, they estimate 18 months would be the very soonest. I mean, things like this often take years, so that's just the best guess. I mean, they already started trials in human trials, so people were actually getting injected with the vaccine, but they have to see how safe it is and how effective it is. So we're a ways off. Melania?
I agree with you. I think there's a lot of excellent research around the vaccines going on right now. And I agree with Sherrie, like the pace is unprecedented, but I think people need to understand that pharmaceuticals and vaccines, these are things that in normal times take decades sometimes. So unfortunately, I think we're a ways away. And certainly from a clinical standpoint, we have not been promised vaccines anytime soon.
And just the last thing to add, that even if we do have a vaccine, there's also the ability to produce a lot of vaccine. So we don't know how much of it there would be to go around. So we have to also take that into consideration.
Yeah. Marco Levitsky clarified his question was about meat packing plants like Cargill, not grocery stores. So, all right.
Cargill was the example that I didn't mention, so it's there. Yeah.
Yeah. Okay. I think we're good, and so I'm just looking at time. We're right on time, and so we were able to answer all the questions. Well, you were able to answer all the questions. And would you like to say in closing, like anything to the community? And
I think I speak for both Sherrie and myself and all the frontline and essential workers when I say thank you to the community for adhering to our physical distancing measures as much as possible. It is making a difference, a huge difference. The fact that we haven't seen the kind of spikes that places like New York and Seattle and Italy have seen in their hospitals is a testament to that. And I know it is hard, but please reach out to your, social networks and call a friend and have a FaceTime chat it does make a big difference. And so, I guess hang in there. We're working really hard in all areas, on the front lines, in research, in modeling, epidemiology, at the gas station, in the grocery stores. I mean, those are essential workers too. And so I think we're all working together and, all doing our part the best we can. So thank you for that.
Thank you.
Thank you. All right. Well, thank you so much, Melania and Sherrie, for this wonderful presentation. It was very informative and very encouraging, I have to say. And yeah, thank you, everyone who joined us today. We're gonna post the video very soon, and we'll send you a link so you can share with your family and friends. There's lots of very interesting and useful information. Thank you, and stay safe and healthy.
Thank you.
Thank you. Bye-bye.
Bye.